According to new research, a cap that zaps tumors with electrical currents may boost survival in patients with a deadly brain cancer. This device is named Optune, and although it does not cure the cancer, patients experienced a 43% survival rate in the first 2 years alone. So joining us this morning are Dr. Roger Stoop and brain cancer patient Joyce Anderson. Thanks for joining us this morning on Saturday bright and early. We appreciate you coming in this morning. Let's start with you, doctor. Tell us about this cap. You've been working on this since the inception. What does it do and how does it work?
So it's not the cap, actually it's arrays of electrodes put on the patient's head and which will give alternating electrical fields. Now, if you go back to your physics course or what you know about magnetism, if you have molecules or substance that are polar, it will go according to the field. So what you have been playing in school with magnets.
Okay.
So here with an electrical field, it's exactly the same thing. And while cells, tumor cells that are dividing are there are a lot of polarized molecules in there, and they will arrange the direction to the field.
Okay, so
now, if you change the field, they have to adapt. And if you do that at a certain frequency, this will ultimately disrupt cell division.
Okay, so I take it you've done some types of scans before you put this on, so you know exactly where to strategically place them. Is that correct?
That's correct. So it is, of course, it covers the whole brain, but the main focus is around where the tumor was, which had previously been resected, yes.
Okay, and so let's go to you. So how long have you been wearing this?
April 27th will be 2 years.
Okay, tell me a little bit about your story. You were diagnosed then a few years ago.
December 2014.
Okay, and then I imagine you had probably undergone certain treatments before this.
I had a full resection of the tumor, and I did chemotherapy and radiation.
Okay.
Chemotherapy was over a total of 1 year, and I did 101 days of chemo.
Wow.
And 30 radiation treatments.
So how effective were those, and is that what led you to this next step, which is what you have now?
Yes. My desire to not take drugs and to try to keep the tumors away without having a lot of side effects and leading a normal daily lifestyle.
Right. So tell me, how was this presented to you? They said to you, you had this other alternative. Tell me, how was this all presented, and what were your thoughts?
We initially found out about the Optune immediately after I was diagnosed. Friends of ours told us about it, and we did a lot of research. And upon visiting my permanent neuro-oncologist, she presented the options and said that this was the best method after chemotherapy and radiation, in her opinion.
So let's go back to you then, doctor. So how effective is this? And is this a last resort option?
No, it's not a last resort option, it's a first resort option. So it's all part of a global treatment concept. We work in teams, so we have a surgeon taking out the maximum he can safely do. We give radiation and chemotherapy at the same time, and then the maintenance chemo Joyce was alluding to for 6 to 12 months. And you're already during that time Optune on top of it, and we have shown in preclinical work that there's a synergy, so this is even more effective. And then we maintain it for 2 or more years to keep the tumor away or to destroy any cell which may be starting to divide again.
Okay, so in Joyce's case then, so how much longer would she need to wear it?
Honestly, nobody knows exactly how much. So for the trial, we actually had set 2 years, so we're getting to the 2 years time point, and I know Joyce has an appointment with us at the Northwestern sometimes in May, where we're actually going to discuss that.
Okay.
And some patients elect to go longer. I think it is really a question of discussion, the pros and the cons.
Okay, so that brings me to my next question to you then, Joyce. So what difference has it made for you? Have you noticed a difference? And if so, tell us.
A difference?
Yeah, as in what this cap has done for you. And I say cap because it looks like one, even though it's not. But what has it made? What has it done for you?
Oh, it's kept any tumors from forming.
Right.
Which is the main thing we want to concentrate on. That's
absolutely. And then the long-term goal, doctor, is what?
So the long-term goal is to cure patients. maybe that's, we can't say that we have achieved that. But again, when I started treating glioblastoma some 20 plus years ago, the majority of patients died within a year. And now we have patients, 40–50% of patients alive at 2 years and beyond. We still lose patients late. So we have to do further research, and I think that's what my colleagues and myself here are doing, trying with further research, refining, and coming up with treatments that are even more effective, like going against cancer stem cells, gene therapy, new targeted treatments, immunotherapy. Which one will make it and how we have to combine it, there's a lot to learn.
So bigger things on the horizon, no doubt. What patient is right for this treatment? Because there's going to be people watching this morning and they're going to wonder if maybe it's for them.
In principle, if the patient is in good general condition, if somebody is already very affected by the tumor, it may not be the right thing, because you still have to carry it around, you have to be motivated. But overall, it is for patients who are, if they are fit for chemotherapy, fit for radiation, I think in principle they are fit also for Optune.
Wow, this is fascinating, and I'm sure you're so grateful to have something like this as an option for you.
Yes, very thankful.
Wow, and can't wait to hear where you go with this, what more discoveries that you find with this, and best of luck to you in your recovery.
Thank you.
Absolutely. Dr. Shute, thank you so much for joining us this morning. And is there a website or somewhere people can go to get more information?
So there is a website, website from Optune, or if you look it up, www.optune, that you can find more information on the website of the Cancer Center. Our Northwestern website has more information. So there's plenty of information out there.
Awesome, great. Thank you so much again for you two for coming in this morning. Great research that you're doing, and can't wait to hear where you go down the road with this. So thanks again.